Okay, so I hope you all are doing great. So let's start with the today's talk is all about the acute respiratory distress syndrome, the ARDS we all know about. So this is the basic pulmonary problem we used to suffer nowadays, and it's quite increasing day by day. So let's learn about this ARDS. So this ARDS is an acute diffusion inflammatory lung injury. It's basically a lung injury, and which is leading to the increase in pulmonary vascular permeability and increase in lung weight. The thing which we have to remember, there is increase in the lung weight, loss of aerated lung tissue. There will be loss of aerated lung tissue with hypoxemia and bilateral radiographic opacity. The thing we have to remember is the opacity, and in the lungs you will see lot of radiographic opacity in the lung, associated with increase in venous admixture, increase in physiological dead space, and decrease in lung complicances. So that thing we have to remember. Some of the basic symptoms of ARDS I want to discuss with you all. There is severe shortness of breath, rapid shallow breathing, tiredness, drowsiness or confusion, and feeling of faintness. That is the major symptom we have in ARDS. If you look around the lungs, and if you look at the chest, X-ray of the lungs, you can see the difference. Lots of opacity in the lungs. You can see here, even lungs won't be able to visible, that much opacity in this ARDS patient. So if you look around some of the basic remedies which we have to discuss now. Okay, so first remedy we will discuss about today is iridicton, a major Indian drug. And iridicton is prepared for ear center, is used to treat dyspnea a lot of in these cases, and it's the remedies of today's world. In Kolkata, in mother tincture, this iridicton we used to use this a lot. The PQRS is that asthma aggravate on change in position. As soon as it changes the position, the asthma, the difficulty in breathing, the dyspnea used to increase, which causes wheezing, whistling. There are lots of wheezing and whistling in respiration. If you examine by the stethoscope, there's lots of wheezing and whistling. And from afternoon to 5 p.m. that's the major timing we have, from afternoon to 5 p.m. That's the major thing we have to think of iridicton. And some of the basic rubric which can be seen, that is asthma from a change of position. In complete repertoire there is only a single remedy, that is iridicton. From any change of position, think of iridicton, my dear friend. And wheezing, and lots of wheezing and whistling, and afternoon to 5 p.m. that's the major theme we have to remember here, that the timing is of this iridicton remedy is very important. From afternoon to 5 p.m. is there any type of asthmatic complaint or the difficulty in breathing types of complaint, think of iridicton, my dear friends. And there is lots of itching in the anterior part of the lung. A single remedy in Allen's report is the iridicton. So potency we should be thinking of the Q, the mother tinctures or the lower frequency. I used to use this remedy a lot in mother tincture in my asthma case. Along with the constitutional rate, I will give iridicton Q and give some miraculous result in this type of pathology. And another very important drug I want to discuss with you, it's the type of a no-sode. It's a hippogyninum. It's a very rare remedy. You might have heard or not, I don't know, but it's a no-sode performed for secretion of bladder of horses. From the bladder of horses we used to prepare this remedy. And whenever think of hippogyninum, whenever there is laryngeal spasm, there is a laryngeal or pharyngeal spasm, think of hippogyninum. It's a gives some miraculous result in this type of cases. So the ailment from a laryngeal spasm, whenever there is a laryngeal spasm, whenever you have tried remedies like argentum met, argentum nitricum or guaicum or something like, and they are not working, think of hippogyninum. Go for higher potency 200 C or 1 m. And there is laryngeal breathing affection causes dyspnea. Whenever there is some laryngeal spasm which is causing breathing difficulties or something like that, think of hippogyninum in 200 C or 1 m potency. I used to give a single dose, and then I can think of some another remedy. Whenever our case of asthma or ARDS got stuck, give this remedy and repeat it, our constitutional remedy. That's the major trick which I can use. So this all type of remedies I have written in my book, that is acute emergency cases to homeopathic therapeutics, from by Dr. Rajarshi Mishra and Nishant Gupta, yes, you know. So I want to show reference to all my teachers who taught me so much And you can contact to me at nishant25smilebox@gmail.com, and don't ever forget to subscribe to my channel.